Welcome to my lecture in psychopathology. Let's get started. Psychopathology refers to people who have some mental health issue with very specific requirements. Archaeologists find evidence that people in early history attributed mental disorders to supernatural powers. We know from his writings that Hippocrates found mental disorders had biological causes. If they were biological, then we could control them. Later, the church declared that mental disorders were a sign of demon possession and witchcraft. That made mental health a domain of the church. And if you were not a priest, then you better not be studying mental issues or you could be excommunicated or worse. Recent analysis of the Salem witch trials suggests that the possessed girls were actually suffering from mushroom poisoning. They were high because that area where the bread was stored was contaminated with a psychotropic fungus, which causes hallucinations. Even today, there are cultures that believe in spirit possession. Some African tribes believe in sorcery, and the Haitians believe in voodoo. The Thais believe in spirits as part of their culture, and if you believe in the Judeo-Christian Bible, it talks about spirits too. But science has taught us that mental health disorders are an illness caused by biological and other factors. We know that Hippocrates was right. So we need to learn a few definitions used in pathology. Hallucinations are false sensory experiences that may suggest but do not absolutely mean that a person has a mental disorder. Hallucinations can have other causes. A person may be on drugs or may have an allergic reaction to some product or may have sensory deprivation. There's a 1980 movie called Altered States with William Hurt. Interesting that it shows a deprivation tank and how it is used. William Hurt's character was placed in this tank, which isolates a person from all environmental stimuli. There is water in the tank, but that's at body temperature, so you don't feel that water while you're floating in it. And there's enough salt in the water to make it buoyant, so you float without having to work at it. The tank is on springs, so it does not vibrate with the surrounding environment, and it is dark, so there's no visual stimuli, and there are no smells. Unless, of course, you ate Mexican for lunch. A person placed into such an environment cannot last very long without seeing and hearing things that do not exist. Delusions are extreme disorders of thinking involving persistent false beliefs. Delusions are the hallmark of the paranoid disorders. Affect is just another name for mood or emotion. I know we don't just say mood or emotions. We use affect. Well, consider this your first finger. Hold your first finger out. What is it? Is it a finger? Is it a digit? Is it a phalange? Of course, it's all three of those things. It isn't as though science is hard enough. They have to make up lots of words for the same thing. We'll just accept it and learn all the possible ways to say the same thing. Now we get to the definition of a psychopathology. It is any pattern of emotions, behaviors, or thoughts that are inappropriate to the situation and lead to personal distress and or the inability to achieve important goals. Notice the events must be a pattern. That means that they are persistent. They must also lead to loss of personal goals or cause distress. For instance, a woman in Saudi Arabia that's walking outside without a burqa is exhibiting a psychopathology because it will lead to personal distress because she will end up in jail. She knows it is against the rules of her society, so it is inappropriate behavior. Each culture has a different social norm, and psychopathology must be described by virtue of society or culture in which we find ourselves. The indigenous Yanomami of Venezuela and Brazil like to use drugs by sniffing them up their noses, but this damages their nasal passages and causes them to leak mucus from their nostrils. They use that mucus, though, to grease back their long hair. I know that's disgusting. No, it's not. In our society, that would be considered unacceptable, and if they could not adapt to our society, we would avoid them, causing them personal distress and the inability to achieve any goals in our society. We see that as a totally unhygienic thing. They would never get a job, but in their society, not a problem. So what is a mental disorder? Remember that there are two approaches to the mind. One is psychological and the other one is psychiatric. Psychiatrists are medical doctors, so they take a medical approach to the mind. Psychologists see the disorder as an interaction of biology and cognition, your thought processes, society, and other factors. Statistics show that 15.4% of the population suffers from mental health problems at any given time, and 32% will have a symptom of a mental health disorder during their lifetime. The medical model is a diseased view of mental health. Remember that psychiatrists are medical doctors. They're trained to look at issues as treatable through a medical approach. In the disease view, the doctor determines what's wrong with you and tells you what to do about it. This is the doctor knows best approach to your health care. The answer will most likely include a medical intervention like drugs or surgery, and the patient, as the person's called, as the sick person is called, will be passive in the approach to the treatment. The doctor tells the patient what is wrong and how to fix it because it's just too complicated for the patient to figure out. Psychologists are not medical doctors. Psychologists work together with the client, we don't call them a patient, to figure out what is wrong. The client is actively involved in helping themselves recover. Many issues can be resolved with a change in thinking or behavior because the issues are psychogenic, meaning they are related to psychological factors. Psychologists will use drugs, but not as their first option. So whether you're a psychiatrist or a psychologist, certain researchers actually believe there are over 300 different pathologies from which we suffer. Before we talk about the different pathologies, it's interesting to review one specific historical note. Just prior to 1800, a man named Mesmer found that he could transfix, as he called it, a patient. He taught his method to lots of people, and it was called mesmerizing a person. Today we call it hypnotism. Mesmer's work later influenced a young French physician named Jean-Martin Charcot. Charcot used hypnotism in his medical practice and studied it extensively in a scientific setting. He was especially interested in hysteria, which could be defined as unmanageable emotional excesses. Charcot had some young doctors helping him, and he gave one of those doctors a hysterical patient to study. The patient would not drink water. She had a horrible reaction to the thought of water. One day, while she was mesmerized, she remembered an event from her childhood and told it to the young doctor. She had watched a man drink from a glass and set the glass on the floor. Unbeknownst to the man, a dog walked up to the glass and drank from it, which she saw. Then the man picked up the glass and again drank from it, and this so freaked her out as a little girl that she did not drink water again. She had forgotten this event from her past, but remembered it in the trance and continued to remember it when she awoke from the trance. And now, as an adult, she reevaluated the event and was able to drink water again. The young physician in charge was a light bulb moment for him and determined that there must be memories that we have repressed that unconsciously direct our behaviors, and when we remember those events, we can consciously change. You may have guessed already, but that young doctor was Sigmund Freud. Today, psychologists have three perspectives on mental health. First, there's the cognitive approach to mental disorders. The cognitive perspective believes that abnormal behaviors are influenced by mental processes, cognition, thinking. It is how people perceive themselves and their relationships to other people that influences their mental health. Next, there is the behavioral approach, which says that abnormal behaviors can be acquired through behavioral learning. This is a byproduct of operant and classical conditioning. How are we trained to be bad? Well, think of children. How often do parents pay attention to their children while the child is behaving nicely compared to the amount of attention they get when they are behaving badly? Parents are rewarding bad behavior by giving the child what they want, attention, when they are bad. In this way, we teach the children to be bad. So if your parents, pay attention to them while they're good much more often. Grab them, kiss them, hug them when they're being good. Tell them that they're good. Pay attention to them when they're good. If you have children right now, stop this. Go and find out what they're doing. Tell them that they're really good and that you're proud of them. The third perspective is the field of biopsychology, which studies the brain and its functions associated with mental health. Genetics also plays a role in some mental health disorders like depression. Most likely is not as simple as only one of the perspectives. It is most likely a combination of the three approaches to mental health. This is what's called the interactionist view, which states that there's an interaction of all three conditions which leads to mental health issues. For instance, a person may be biologically predisposed to depression. We know this can happen with the serotonin gene. They get overworked and stressed at their job. Their car breaks down and their child gets sick. Their thoughts then turn negative, and all of these events lead to depression. So think back to the comments about the Yanomami of Venezuela and Brazil. How do we determine what is abnormal behavior? If the behaviors or thoughts are statistically rare in a society, then they may be considered abnormal. If the behaviors or thoughts deviate from an acceptable social norm, the standards and values of that particular society, then they may be considered abnormal. There are a number of judgments that we can make about thoughts and behaviors that can help in determining abnormality. We can look at the etiology of the disorder. Remember that disorders are defined in the DSM, Diagnostic and Statistical Manual, through their symptoms. So here are a list of 6 symptoms that can be considered causes or factors related to the development of a disorder: distress, irritability, unconventional or undesirable behavior or thoughts, maladaptiveness, unpredictability, and observer discomfort. So let's look at each of these a little more in depth. The first is distress, fairly easy. It can be defined as whether the individual shows unusual or prolonged levels of unease or anxiety. Maladaptiveness can be defined as whether a person acts in ways that interfere with his or her well-being or the needs of the society that they occupy. Irrationality can be defined as whether a person acts or talks in ways that are irrational or incomprehensible to others. It used to be that we could tell someone had this behavior as they walked down the sidewalk talking to people that didn't exist, but today that may simply be a Bluetooth phone conversation. Unpredictability is when a person behaves erratically and inconsistently at different times or from one situation to the next, as if they're losing control. In the Big Five inventory, this is called neurotic, and the opposite of that is stoic. When trying to discover if a person has a mental disorder, we can also look at unconventional or undesirable behaviors, which are behaviors that are statistically rare and violate social norms of what is legal or morally acceptable or desirable. For instance, like walking downtown with no clothes on. Unless, of course, you are living in a nudist colony. Lastly, when analyzing a person to determine if they have a mental disorder, we look at observer discomfort. Does this particular individual behave in such a manner as to make those around him or her feel uncomfortable, threatened, or distressed? We're talking about bullying here, not that a person may feel threatened simply by your presence because they have a problem with who you are. That does not make you a bully. For instance, if you're Muslim or if you have dark skin, both of those are acceptable in our society. So bullying is one of the etiologies, which means a bully already has one of the etiologies of a pathology. I'm hitting 15 minutes here, so this is the last slide for this section. Take a little break and come back, and I'll talk to you again in the next.